Hello, good evening, everyone. So this is for the Section 1 candidates who are appearing for their exam in January 25. We have 2 weeks left for your exam, and I'm sure that your preparation is going at full swing. You are revising at your full pace, and you must have solved most of the questions from the available sources that you have by now. But then if you are having mixed feelings at times and then you are slowing down at some days, then this is absolutely normal. Okay, it's absolutely normal to have this kind of feelings before your exam. Some of the candidates were requesting if we can conduct a rapid revision session where we can discuss important topics from urology in a single day because not everybody are getting leave from their work to study and not everybody is able to maintain the focus which is required at this point. So for them, we are having this test and discussion session. Now, regarding this, so we are going to have 100 questions, which will be single best answer questions, and this will be online exam. This will be started from 5th of January, that is Sunday, and it will remain live till 7th of January. So what we are planning to do is this 100 online questions will be available to you when you scan the QR code anytime between 5th and 7th of January. So you can solve the questions over 90 minutes. Once you solve the question, once you start the exam, once you scan the QR code, you won't be able to go back and pause the exam or come back later on. So when you're prepared, when you're ready for the exam, go for it, attempt it, and complete it. When you submit the exam, you're going to get answers. You're going to get your answer which you marked correctly, which you did not mark correctly, and you're going to get the right answer for the questions by 7th of January. What we were planning after 7th of January, on 8th of January, we are planning to have a detailed discussion of the 100 questions that we had during our online exam. So we are going to have 100 questions from the different topics in urology so that we can discuss in detail 100 topics which are going to help you definitely in your rapid revision, and it's going to take about 4 hours to discuss those 100 questions. We are going to have a short break in between, and once we are done with the discussion, you will be getting a recording of the discussion in case you were missing out certain points, you want to revise something. So that's our plan for the test and discussion session. I'm sure this is going to help you in boosting your speed for the revision, and you will get an idea of orientation to the exam format as well, the kind of questions which are being asked in the exam. You'll also get an idea about the image-based questions, okay, from the different topics, from the CTs, from the MRIs, from the urodynamics. You'll get a lot of image-based questions in your exam. So we'll be trying to keep image-based questions as well, and you'll be able to assess your performance. But I don't want you to be scared of the 1 week time. Before that, if you give your exam 1 week before your actual exam, you might lose out confidence. Don't take it like that way. Take it as a positive feedback for your preparation so that you can rapidly revise in a very short time important topics. So take it that way. This will definitely give you an extra edge over the other candidates. Let me give you an example what we are planning to do. Suppose this is a question that you get in your online exam. Okay, so this is about a ureteric injury. There are 5 options. Let us see this question. So, true about which of the following is true about ureteric injury? So, is it the ureteroscopic injury is the most common? Maybe, may not be, not sure. During hysterectomy, pelvic brim, the ureteric injury at the pelvic brim is because of the ligation of uterosacral ligament. No, it's not. It's the infundibular pelvic ligament. Okay. Injury can occur at the anterior fornix of the vagina. It's not the posterior fornix where the ureter will enter the bladder during hysterectomy. Penetrating injuries are common than blunt trauma. I'm not sure. And presence of hematuria is a reliable indicator. Maybe, may not be. So there are going to be confusion. But then suppose you have studied this from the standard sources and you know the right answer is option D. You mark it. And then once you mark it, you submit it and you'll get the response. And when we discuss it on 8th of January, we're going to have a very brief discussion on the ureteric trauma. Okay, we are going to find out important points that we should remember that should come into our mind whenever we hear of ureteric trauma. Okay, so penetrating injuries are the commonest form, and blunt trauma constitutes only 1/3 of the cases. Among the iatrogenic causes, it's the gynecological surgeries which are the most common and not the ureteroscopic surgeries. Okay, and regarding hematuria, we have to think about a renal trauma. Yes, it's really reliable, but for a ureteric trauma, it's an unreliable and a poor indicator of ureteric injury. And Regarding briefly about the management, if you are immediately diagnosing a patient is stable, go for repair. Unstable, diversion. Delay diagnosis, diversion. So this is the basic algorithm you should know because you will be getting questions on this, and then you should have a very clear idea what should you do next in that case. So if we quickly revise this in less than 5 minutes, we are going to have an idea. If we get a question on ureteric injury, we will be able to remember the salient points on that. So you don't have to go back to the references when you solve the questions. When you get your answers, no need to go back to the references and find out the right answer, why your answer was wrong. We'll be doing it for you. On 8th of January, we are going to have a detailed discussion of your answers, your mock exam, and we'll try to keep all the 100 questions from different topics so that you can revise most of the topics during the 4 hours of discussion that we are going to have on the 8th of January. So that's our whole plan. Take it as a rapid revision strategy. It is going to have a positive impact, and don't think that you will lose your confidence. It's not like that. It's going to just boost your speed, and especially if you're not able to focus at this point, especially if you're busy at your work, this is definitely going to help you. If I was a candidate, I always wished this was available to me. You will be able to focus, you will be able to get idea about the image based questions, so there are a lot of advantages that you have. So that's all about this test and discussion, since you were having a lot of emails regarding this. So I came up with this short video for introduction of this test and discussion session this weekend, and it's going to continue till 8th of January. All the best. Keep revising, keep studying. That's all that you have to do for the next 2 weeks. Let me know if you have any questions. I'll be dropping my email ID and the link in the description. Thank you so much for watching this video.